The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. My guest today on Meet the Doctor is Anna Steve. She's a plastic surgeon and she's in New York City. It's so good to see you again. Thank you for coming back.
Likewise. Nice chatting with you again.
I guess you were on another one of my podcasts called the La Jolla Cosmetic Podcast, where we debated breast size, shape, and trends, East versus West Coast. So that was a good one. And I'll link that in the show notes if anyone wants to go hear our lively debate about breast implant style. That was a good time.
Yeah, that was fun.
So tell us about yourself, and then we'll talk about social media a little bit.
Sure. Yeah, so my name's Dr. Anna Steve. I'm a plastic surgeon in New York City. I specialize in all things breast, so all sorts of breast enhancements, including breast reconstruction revisions for people who haven't reached their final desired aesthetic, as well as tuberous breast reconstruction and breast enhancements of any kind for sort of women of any age.
Do you enjoy breast implant problems or breast problems in general?
Well, I don't enjoy the problems, but I like the challenge of trying to solve the problems. And that's sort of what plastic surgery is all about, is sort of offering solutions for people who have a frustration that they've reached the limits for how much they can improve it on their own. And that's what I truly love about plastic surgery. And so I do see women who've never had breast implants before, and they're, embarking on the journey for the first time, as well as women who have had breast implants in the past, enjoyed them for a number of years, but for whatever reason have encountered a change in their life that's changed how they look, or a change in the shape and feel, and are looking for a solution for how to either improve them or increase size, decrease size, restyle them, change the position in some way.
You said something curious about couldn't solve the problems on their own, and I wonder, how would you solve breast problems on your own?
Great question. So for some women who are struggling with a significant size that's burdened to them in terms of problems with back pain, neck pain, that sort of thing, those women are often seeking solutions that involve a breast reduction. And in those cases, they've often reached a limit. They've maxed out their exercise. And for some reason, they were born with larger breasts than their shoulders and neck actually support comfortably. And in those cases, if they've reached their optimal weight and still have a problem with large pendulous breasts, breast reduction is a nice solution for them. Similarly, while I specialize in breast enhancements, I also perform a full spectrum of body surgery. So I find in women post-pregnancy, they're more frustrated with problems of excess skin than they are excess weight or problems with muscle separation. So to some degree, people can strengthen their core, but if you've got a separation like a diastasis recti, which is a separation between the abdominal muscles, there's really no way to fix that, regardless of the amount of exercise you do, without putting those muscles back together. And the frustrating part about having excess skin is you can't really exercise your skin. So for those women who have that stubborn bit of excess skin that's persisted post-pregnancy and they're at their optimal weight, they often find the excess skin actually looks worse post-pregnancy. And so the solution for that is to remove the excess skin. And those are solutions that a lot of women seek because they've maximized what they can do on their own and are still at a point where they don't quite feel comfortable in their own skin.
For someone who's in this situation and doesn't necessarily want to have breast implants, what can you do instead?
Great question. So a lot of women are seeking non-implant-based solutions. Typically, that involves a combination of strategies. It might incorporate a breast lift, and fat transfer is really making its way into breast enhancement. So that's removing stubborn fat from any area in the body and then transferring it to the breast to create some natural volume. I use fat transfer in the breast a lot to combine with an implant for women who want a more natural looking breast augmentation. I use it in breast reconstruction revisions a lot for women who have some contour challenges or some mild asymmetries between the sides. And then I also do breast fat transfer for a lot of women who want a breast lift without an implant, and they just want to restore a little bit of natural volume to the upper portion of the breast. In rare cases, we do breast fat grafting alone with no other enhancements for women who just want sort of a modest change in volume, or they want to add a little bit of volume to sort of hide their rib cage a little bit because they're very thin. I find the patients who benefit most from fat transfer only to the breast are really thin patients who don't have that much to begin with. So a small amount makes a meaningful difference.
And if they're really thin, do they even have enough fat to move, or is that a challenge too?
We can always find fat from somewhere. There's also some off-the-shelf fat products that can be used in women who don't have enough fat on their own, or combined with fat transfer in people who have a very minimal amount of fat.
Where does that fat come from?
So that's harvested from cadavers, just like some of our other surgical tools. So it's all of the cells that would cause problems if you transferred cells only from someone like a donor, like a husband or a person like that. People often wonder if you could donate fat. You can't donate fat.
I have wondered this a lot, actually.
Yeah, specifically husbands looking to support their significant other wonder if they could donate fat. Unfortunately, if we tried to donate fat from another living human with the normal cells there, you would reject it. But in the situation where we remove it from a cadaver and that fat is processed in a way to prepare it to inject into the body, you don't mount a rejection response.
Interesting. Yeah, when you say off-the-shelf fat products, it almost sounds like you could go to the fat store and just pick some up for wherever you need it.
It's rare that people are fat shopping. Most people are trying to get rid of it. But
I'll trade you my fat for something better. How has your breast reconstruction training and your experience with that patient informed the way you approach your cosmetic patients?
I find there's so many similarities in terms of the line between the two. It's definitely a gray line. And I find the breast reconstruction practice has really influenced the strength of my breast revision practice because the principles are so similar. When you're thinking about each individual, and tuberous breast is the same, each individual has such a unique problem, and you need to use your toolbox to solve the problem and create an individualized custom approach to deliver the results that the patients are interested in. And that's what breast reconstruction is all about. Every situation is a little bit unique and a little bit different and a little bit challenging. So it's more about relying on sort of like the tools that you have and coming up with a creative solution rather than following a step-by-step approach that's the same cookie cutter approach every time. And that's really something that's unique to plastic surgery as a field as well.
Is there a patient you can think of that illustrates this? Is there a story you can tell us about somebody that really illustrates this way that you think about breast surgery?
Yeah, so I think one of my most recent breast cancer reconstruction revisions is a great example. She had breast reconstruction after her mastectomy on one side and had a balancing procedure on the other side. And at the end of that journey, she lived with her reconstruction as it was for a number of years, but she felt like it didn't really give her back the aesthetic that made her feel whole again. And so in her case, she came seeking a solution for better symmetry, a slightly more natural looking result. And she had some significant contracture on the breast reconstruction side that caused her discomfort. So it was a kind of a combination of an aesthetic challenge as well as a functional challenge. And for her, it was a reminder of her journey with breast cancer not being sort of totally at the end of her journey. And so in her circumstance, we sort of talked about all the different tools we had and all the different tools we could use to provide an enhanced result. And we used a combination of a lot of things. We used an internal bra, which I use a lot in both breast reconstruction and breast revision. We used fat transfer to add some natural tissue. We used 2 different size implants because, of course, she had a normal breast on one side and no breast on the other side. And then we used breast lift techniques on the unaffected side to create a higher, tighter look on the side that was unaffected by the breast cancer. And so that was a good example of sort of using all of those techniques and using all those tools, and also someone who kind of crossed the line between aesthetics and reconstruction. And in the reconstruction world, she'd been orphaned a little bit because they had, I think a lot of women in that circumstance are made to feel like they should just be happy with their reconstruction because they had a reconstruction for whatever reason. They should be grateful for that. And a lot of those women actually, unfortunately, feel like they are being ungrateful when they're not totally satisfied with their reconstruction, even if there's not a problem. And so I think that really demonstrates how important the aesthetic component of it is, and how important that aesthetic component can be actually to the breast cancer reconstruction journey as well. Most of those women I find they're looking to sort of feel that their aesthetic matches them feeling whole again. And I think that's, something that if their reconstruction in its early phases hasn't provided, it's important for them to know that there are more options out there available to them.
If you had a reconstruction that didn't go well, and then you were forced to look at that every day and be reminded, even 5 or 10 or 15 years after you beat breast cancer, I think that would be pretty unpleasant to live that way.
Yeah, and I gratefully in my breast reconstruction training, we did a lot of optimizing. So we did a lot of secondary and, even beyond secondary surgery to sort of optimize outcomes. That was a big part of my training. And so that really taught me how much achieving that final aesthetic can make a difference in someone's journey.
Yeah.
And it's tricky. Sometimes in the reconstruction world, we get overburdened by the amount of new breast cancers that needed to be treated and primary reconstructions that needed to be done, especially in some of my training in Canada. And so I think sometimes those patients who haven't quite reached their final aesthetic are just a little bit lost in that world, and they get, pushed down the waiting lists and that sort of thing.
Canada is certainly its own system.
Mm-hmm.
And I think in aesthetics, just writing about it and marketing procedures, I had crossed over into breast reconstruction a lot, but didn't really understand how the system worked until I had a friend go through it. And if you are lucky, you are in a system, in a healthcare system where all of your care from the beginning to the end, the chemo, the reconstruction, the radiation are all carried out by a team of people who talk to each other. But not everyone gets that experience. Mm-hmm. And even if you do, you don't know if the plastic surgeons in that system are great. So we always had this idea that you could choose your own plastic surgeon for your reconstruction, but didn't see the bigger picture that if you're in a system like that, you may not actually really get to choose. And if you do, you're on your own. You have to figure all of that out by yourself. And that's a lot of work when you're going through cancer treatment.
Yeah, it's a tricky system to navigate. And I think the other important thing to understand is breast reconstruction is a process. So just because you didn't achieve your desired outcome with the first reconstruction doesn't mean that you had a bad team or a bad surgeon or were in a bad system. There's just the primary goal typically during that stage is to make sure that the cancer is treated and the cancer is gone. So the primary goal is a little bit different, whereas sometimes at a later stage, you have the benefit of time and knowing, that the cancer, which is the most important thing, is taken care of, and then you can focus a little bit more on the aesthetics later.
Well, that was a long way around to the cosmetic approach, and I think it's always really valuable to patients when a surgeon like yourself has the reconstructive experience and is bringing that to the table. And when you were describing your patient, it sounded like it was really 6 different procedures in one person.
Yeah. But that's the sort of toolkit approach, I think.
Mm-hmm. Mm-hmm. Very well-rounded. So you've mentioned Canada a few times, and I heard you say process. Are there other words that you say that are very Canadian?
People say about, but I hear it the same as you say it. So
I'm from Minnesota, so I get it. I tried to get rid of it, but sometimes it still shows up. How did you end up back in New York City?
So I did some of my subspecialty training in New York City. And while we were here, my husband and I fell in love with the city and the energy. There's really no place like New York City. And I see that in my patients. I see that in my colleagues. And it's really a motivating place to be and work and live.
What do you love about your job?
I love everything about my job. And I think that's what makes it easy to,
You just lit up like a Christmas tree when I asked you that.
I think in terms of a surgical specialty, it's the most unique specialty because we really do offer solutions that sort of reconstruct and recreate and optimize outcomes rather than taking something away. That's very unique to plastic surgery. And I do like that sort of, toolkit that it provides you with to sort of customize the approach. I'm fortunate to work at an excellent office, and all my colleagues share the same spark and love for what they do, and that makes workdays a nice environment to sort of go and have a nice team as well.
There's this campaign a few years ago called "I Look Like a Plastic Surgeon." Do you remember this?
Oh yeah.
And I was trying to figure out how to ask you if people are surprised when they see you and find out that you're a plastic surgeon, because you don't look like a plastic surgeon. But that's not fair, because who looks like a plastic surgeon?
Yeah, it's interesting. I would say the most resounding theme among my patients is you look too young to do this. And I have our nurse injector to thank for that. But aside from that, I'm not sure what makes someone look like a plastic surgeon. Aside from maybe if I put my scrub cap and a mask on, I could fool somebody
into thinking you are one or not.
Yeah.
Okay. Outside of work, you have lots of reasons to be joyful away from the office. Can you tell us about them?
So my family is what I spend most of my time and energy enjoying outside of the office. So we have 2 young kids. They are 1 and 3. And so they're sort of loving, New York City from a totally different perspective. So we explore a lot of the parks. We're trying to seek out all the places we can to get our young Canadian-born son skating. So we spend a lot of time
ice skating?
finding ice time. Yeah, and then we sort of enjoy the city through food, which is a great way to explore all the different areas of the city. We're sort of on the hunt for New York's best almond croissant, and we've probably eaten about 100 to 150 different slices of pizza.
Someone told me earlier today that there are over 30,000 restaurants.
It's crazy.
And that you could go to a different one every day for the rest of your life and you wouldn't make it to them all.
Yes.
So how many almond croissants do you think there are to try?
Oh, I don't even know. But we've got a long list of the next 10 spots.
Is this also a Canadian thing?
No, that's just something that we find if we choose a food to sort of do a bit of a comparison, then it gives us sort of an area of the city to go to explore as a family, because we go sort of to all the different areas. One of our favorites is in Brooklyn, just across the way, and that sort of takes us over to that beautiful boardwalk in Brooklyn Bridge Park. So it's a nice way to sort of, rather than choosing a destination in terms of where you want to go in the city, we choose an almond croissant shop and then explore the area.
I like it. Well, in Austin, the equivalent would be the breakfast tacos. We would go all over the city for those.
Oh, I was going to say barbecue. We went to Franklin's barbecue actually as a family.
Oh, how was that?
It was great. Yeah.
Did you have to stand in the line?
Yeah, double stroller and all.
Oh, wow. I hope it wasn't too hot that day.
No, it was a little off season. So the line was
shorter
than usual, but
I got the best tip from my hairdresser. If anyone's in Austin and wants to go to Franklin, go at 1:30 and stand in the line anyway. And there's a guy who holds a sign that says last man standing. And that guy is guaranteed to eat, and no one after him is. But the truth is, about 30, maybe 40 more people after that guy will still get to eat.
Oh.
You just might not get 1 or 2 things. They might run out of something.
Amazing. Well, the plastic surgery meeting, one of the big plastic surgery meetings coming up is in Austin. So
October. Yep.
Yeah.
First time.
We'll look forward to returning. Lots of fun stuff in Austin.
Is there anything else you like to do outside of work for yourself?
I do. I energize, I think, by staying active. So I like to run in the park. I'm a new sort of member of Berries. It's a sort of HIIT style workout with lots of locations. I don't know if they have one in Austin, but we do a lot of team workouts as well, which is a nice way to sort of connect with colleagues outside the office.
If someone's listening today and they want to learn more about you, where should they go?
So you can follow us on Instagram. I'm Anna K. Steve MD, as well as Twitter.
Do you actually
Twitter?
tweet?
I shouldn't say Twitter. I meant to say, that makes me seem so old. TikTok is actually the other like social media outlet that I would say I try and put out the most like educational content. And TikTok is a little bit more interactive. So I have lots of people who ask questions, and then you have the ability to sort of answer on that avenue.
Yeah, Doctor Twitter is interesting and fun to follow, but it's way more doctor to doctor than doctor to patient. So.
Yes. Yeah, Twitter is a little bit more like academic and a little bit more focused on like colleague to colleague. And I think the most fun part of social media for me is sort of exploring what types of questions that patients have and what sort of education that they're seeking, which is a benefit that I didn't realize social media would bring to my practice, but it really helps me understand sort of what patients are thinking. So I love the engagement both on Instagram and TikTok.
So if people DM you on Instagram, are they actually going to get you?
Yeah. Yep.
Yeah.
Yeah, I love the DMs are a great way to ask a question that you maybe don't want to put out there to the whole crowd. And then if you're interested in like connecting about a consult, lots of people DM just to see sort of what the basics of like how to get set up would be. So I connect them all with my surgical coordinator, and then she reaches out and we can make an appointment from there.
Well, thank you for joining us today on Meet the Doctor. It's such a privilege to hear your story.
Well, thanks for having me.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.